And still on health, patients who suffer a stroke and fail to get immediate medical attention now have a fighting chance at a full recovery. Doctors here will consider operating on them to remove the clot in their brains beyond the recommended 6-hour window after the stroke occurs. This follows recent overseas studies which prove that surgery, even at a later stage, can improve the outcome.
Previously, if you arrived at a hospital more than 6 hours after having a stroke, there was little doctors could do. But recent US-led studies have changed this perception.
Beyond 6 hours, we do not know, because as time goes by, more and more brain tissue dies, and there's nothing left to salvage. However, with the publication of these two trials, it has been shown that with more advanced imaging, there is still a small group of patients with salvageable brain cells that we can help with this clot removal techniques.
From early this year, doctors at the National Neuroscience Institute have been using more advanced imaging technology to carry out detailed scans that determine how much brain tissue can be salvaged. This helps them decide if a stroke patient is a good candidate for surgery.
We've had a few patients who have been treated at NNI outside of the usual time window, and they have done very well. I think they have had excellent outcomes because they have regained a lot of their functionality and their independence. It is unlikely that they would have been even considered for the treatment before the trials came out.
Still, doctors caution that only an estimated 1 to 3% of stroke patients who come in after the 6-hour window will be eligible. This comes down to various factors like a patient's age and his health pre-stroke. Stroke is the leading cause of adult disability in Singapore, with some 8,000 people diagnosed annually. And early intervention is still the best shot they have at making a full recovery.